The project is called Just Get On With It, and it's a report into the wellbeing of prison governors and prison managers for the Prison Governors Association.
While a lot of research focuses on the wellbeing of people serving sentences in prison, we wanted to focus on how prison life was impacting those, particularly those in management and leadership positions.
So we were interested in searching out in much more detail how people were feeling.
And we wanted to really make sure that we could get the voices of those people out and sort of understand their health and wellbeing more.
And we were really heartened by the number of people who wanted to speak to us. And I think that was quite reflective of the fact that maybe they were feeling unheard.
So what we found was they opened up very quickly about their experiences. They were very candid. I think most of them want to use this as a way of creating change within the service.
We need to be able to understand those human narratives of people who are working in a very challenging environment.
We interviewed 63 prison governors and managers. We had a series of open questions that we asked them, qualitative interviews that we did online.
They felt that we listened in a way that no one had listened to them before and validated their feelings.
And actually quite a few people commented that it was quite a cathartic process for them to feel heard.
They were explaining that this is actually probably the first time that they felt able, safe to sit and talk about how they're feeling.
When we did the interviews and we looked at the data, we started to see recurring topics and themes coming through.
There was an overarching theme around cultural challenges to workplace wellbeing. The wellbeing of prison governors and managers was not good on the whole. There were dominant themes around high workloads that were impacted by a multitude of factors. There was the macho culture that was described by participants, expectations upon prison managers and governors placed by multiple people, multiple sources. There were them and us divides across different groups where people didn't necessarily appreciate different roles and different perspectives. And then there were more cultural challenges around autonomy and responsibility. And what these challenges had led to overall is a significant negative impact. They talked about work impacting on their life in some ways 7 days a week.
A lot of them are on call, a lot of them will work evenings and weekends.
And that was having a significant impact on respondents, on their physical health, on their mental health, and also on their relationships with their friends and their families. Some of them said that it led to divorce, many of them not seeing family members, particularly children, who were missing out on parts of their life, but this was an expectation of taking those jobs.
And the support that they had available to them, such as PAM Assist, they didn't feel like it was very accessible to them, or that they had time to engage in some of the wellbeing initiatives that were offered. And it connects into the idea of that macho culture that people just put a front on about what they're experiencing and don't want to share the extent to which perhaps they're struggling.
There's real concerns that if you do open up about your mental health and ask for help, that it can impact promotion, it can impact on whether your face fits. So a real unhealthy culture in terms of managing and dealing with mental health, stress and trauma.
I think what's come from the data is a complex picture. We're talking about people working in very complex situations, very complex environments.
For me, the biggest thing that I took away from it was that they don't feel valued. But what it didn't seem to massively impact on was their commitment to it. Regardless of how they're feeling, that sense of pride is still there for most of them. They are proud to work for HMPPS. They're proud to do the job that they're doing, to make a difference to people's lives.
I think all of us feel a real responsibility to try and drive this research forward, to disseminate our findings and try and make a difference, because listening to some of the stories that our interviewees told us was quite heartbreaking.
And all of the researchers feel that we have that obligation to our responders to help them make the changes that will support them and improve their well-being within prison service.
They need support that is structured, that it is part of their job, that it becomes normal for them to talk to people about what they're going through, talk to people about how they're feeling.
And to think collaboratively and positively and proactively with HMPPS, with the PGA, about what we can do to take these conversations forward and act on them. Because ultimately, whether you're a governor, officer or whoever working in a prison, this is not a normal working environment.